Hello. Lebanon is in mourning after the huge explosion in the capital Beirut yesterday, which devastated the port city of the city and damaged many streets and buildings well beyond. While the Lebanese Red Cross has said that at least 100 people have been killed and more than 4,000 injured. The huge blast at the port sent shockwaves right across the city, destroying many nearby buildings and blowing out windows several miles away. An investigation is now underway to find out exactly what caused the blast. The country's president said that over 2,000 tonnes of ammonium nitrate had been stored unsafely in a warehouse for 6 years. While Lebanon's Prime Minister has warned those responsible should now be punished.
What happened today won't pass without account. Those responsible will pay the price for what happened. This is a promise to the martyrs and to the wounded. This is a national commitment. Facts will be revealed about this dangerous warehouse that's been there since 2014.
While hospitals across the city were quickly overwhelmed, officials fear the death toll will rise sharply. Rescue workers are digging through the rubble to try to find survivors. This report from Sean Dilly contains some distressing scenes.
It was a catastrophic explosion.
What?
The blast was heard 150 miles away. Another view from moments earlier shows a fire in Beirut port. Authorities say the flashes were caused by fireworks. But then, as the sound of the explosion rang out across the city, windows smashed and buildings were destroyed. From the streets, Beirut could only watch as the carnage unfolded.
We were at home. We heard what sounded like fireworks. We thought it was a container in the port that was on fire. A few seconds later, we were flying through the air.
Already heavily stretched by the COVID crisis, Beirut's hospitals were overwhelmed by casualties in need of urgent treatment.
We have at least 300 wounded in the hospital right now. We have 6 operating suites that are still operating right now, and this keeps filling up by another group that needs attention. We have about 4 to 5 in intensive care. We have 3 that arrived dead. Every one of our crew, doctors and nurses are operating. Even administration, everyone is working. We have a lot of damage, as you can see. All the ceilings have collapsed at the entrance and the glass windows of patients' rooms.
As embattled medics struggled to help the injured, distraught locals sought to find lost relatives.
He's 29 years old. From 7 o'clock in the evening, we've been all over every hospital in Beirut, and we are now waiting for the names to come out, and nothing has come out. We don't know if he's dead or alive. We just don't know.
The international community has offered its help to a city in turmoil. Boris Johnson tweeted, "The UK is ready to provide support in any way we can, including to those British nationals affected." Lebanon's president has announced 3 days mourning and promised to release 100 billion lira or £50.5 million of emergency funds. Officials say highly explosive materials, believed to be ammonium nitrate, stored in a warehouse for up to 6 years, caused the explosion. They say they're investigating what ignited it. In the meantime, authorities say those responsible will face the maximum possible punishment. Sean Dilly, BBC News.
Well, we can speak now to Dr. Faris Abiad, who's the head of the Rafiq Hariri Hospital in Beirut, the largest public hospital in Lebanon. Thanks for joining us today. How many people have you had to see, and what conditions have they been in?
We have received almost 200 casualties. Some of them arrived dead, and we have admitted more than 22 cases to our intensive care units.
And what sort of injuries have people been suffering?
Well, initially, most of the people who were coming, and they were coming in tens, were from glass injuries or people being, just thrown off up in the air from the impact of the blast. Then later, the ambulances started arriving from the blast site, and they were bringing in people who have been more serious injuries.
How many would you say are now critical?
We have about 18 patients in our critical units, and we still have some patients in the emergency room. We're waiting to see whether we can find places for them in our hospital or they have to be transferred to other hospitals.
Just how overstretched are you? You're talking about obviously not being able to treat even everyone that's coming in.
Yeah, I mean, the level and the numbers of casualties that we've seen yesterday was unprecedented. We haven't seen that even in times of the civil war. And I think that all the hospitals were stretched. Add to that some hospitals were damaged and had to be evacuated. So we were actually receiving both casualties and patients being evacuated from other hospitals as well.
And do you know how close to the blast people were affected? Do you have that sort of information?
Well, from talking to the first responders and the EMS services, we know that a lot of the buildings that are in the vicinity of the blasts, they haven't been swept up, and they are going into those buildings, and we expect that the number of dead will rise as they do.
And is there anything in terms of external help that the international community can do quickly to help?
I think that all help is appreciated. I think whether it is in medical supplies, whether it is probably, we don't know the status of the stores. You remember this is the biggest marine port in Lebanon, and there were a lot of merchandise there. So up till now, we don't have an information about how that affected the situation.
And can I just ask also, is it sort of men, women and children? Is it families? Is it people that were living or working in the area that have come into you?
The extent of the blast is, I cannot describe it. I mean, people have heard the impact of the blast in other countries. We've heard that in Jordan and Cyprus, they've heard the impact of the blast. So I think that a lot of people have been affected in the capital and outside.
OK, Dr. Firas Abiad, many thanks indeed. Well, we can speak to our correspondent Lena Sinjab, who is in Beirut also for us. And Lena, just tell us what is known, first of all, about how this blast happened.
So far, it's really hard to tell what are the causes behind the explosion. We know for sure that there was a storage of explosives that have been stored there for almost 6 years, since 2014. And there has been many calls, it seems, that they should be destroyed or, stored in a safe way, but they haven't been. And this is the main reason of the explosion. But it's hard to tell at the moment what caused the initial flame that caused the explosion. The government has opened a big investigation, and they're expecting some outcome to come in the coming 48 hours. But at the moment, the situation is really devastating. I'm standing just a few meters away from where the explosion happened, and you can see still the smoke coming out from the port of Beirut. This is the main port that import and export material to Lebanon. Lebanon relies heavily, almost 90% of its consumption is imported, and now the port is out of function completely. And around the port, this is like the lavish downtown Beirut and the Beirut city center. Most of the buildings have like their windows shattered or out of function, and the damage also in among people around. Around Lebanon, 4,000 casualties so far, and also, of course, there are almost 80 people who died so far. The hospitals are, rushing, and they're out of capacity. They're helping each other. It's really difficult situation, and with the economic crisis here in Lebanon, they'll have to rely on international aid to come and help them out. Otherwise, they won't be able to stand on their feet with this.
And are the hospitals? We just spoke to one doctor, one head of the hospital. Is everyone getting the treatment they need at the moment?
The health system here is really good. They are divided between private and public sector. But of course, at the moment, it's a moment of emergency, of catastrophe. All the hospitals are responding, the Red Cross is responding, but the number is huge. And don't forget that this is a country that's also struggling with the COVID-19.